Hello everyone and welcome. This article titled What Ultimately Matters in Root Canal Treatment Success and Tooth Preservation, a 25-year cohort study published from Brussels in Belgium. The aim of the study is to present the results of a systemic data collection over a 25-year period with treatment success and tooth preservation as the measured outcomes. For the methodology, all the patients who received an endodontic treatment from 1990 to 2016 provided by a single operator, the primary investigator. All the cases were done whenever possible in single visit. However, when multiple visits were done, the reasons for these visits, either lack of time or inability to dry the canals, and canals were dressed with calcium hydroxide for inter-appointment dressing, and the data were collected for clinical, technical, radiographic, patient-related characteristics and follow-up assessments using FileMaker Pro software. For the outcome measure, two outcomes were measured: root canal treatment success and tooth preservation on the arch. So it is either success or survival. And the global success of root canal treatment is represented here in the figure. Clinical success, absence of clinical signs and symptoms, swelling and sinus tract as well. And for radiographic success, absence of periapical bone radiolucency. And whenever a periapical space less than 2 millimeters was considered to be within a normal physiological range, and radiolucencies more than 2 millimeters were considered diseased. And cases where improvement was observed clinically or radiographically but was later followed by deterioration was classified as failure. Now for the results, 2,500 root canals were performed in this study. 1,063 were root canal treatment primary and 1,437 were root canal retreatment. And 56% recall rate was achieved at 25 years. And 20% of these teeth were vital teeth, and 50% of these vital teeth were symptomatic. The arrangement or distribution of the teeth is almost symmetrical, with the left and right side and maxillary and mandibular teeth, and having molars for the highest number of teeth and the canines for the lowest number of teeth. The significant factors identified for the global success of root canal treatment were preoperative pain, persistent pain, and incisor tooth. And for the technical results or factors in the result were the presence of technical complications before treatment, which is perforations, separated instruments, canal transportation, etc. And for the outcome of tooth preservation, which is the survival, combined endodontic periodontal lesion was one of the highest, and clinical failure of root canal treatment was the second highest factor. And the least successful group were incisor being regarded the least successful in treatment success group, and molars in the tooth preservation or survival. The Kaplan-Meier survival curves shows that the size of the lesion significantly impacts the survival of the teeth, and teeth from 0 to 2 millimeter, which is considered normal in the criteria of the study, had the highest survival. However, it dramatically drops whenever the size of the lesion is more than 10 millimeters. Regarding tooth type, canines had the highest survival, followed by premolars and also as well molars. However, incisors were one of the lowest survival regarding the tooth type. But for the model of tooth preservation, which accounts for survival in this case, canines and incisors are the highest, and premolars and molars are the lowest, with molars being the least surviving teeth. Now we can see that in success criteria, incisors become the lowest successful teeth. However, they are not the lowest surviving teeth. Molars tend to be extracted more. and the most treatment failures underwent retreatment, and only 1/3 led to tooth extraction. Most extractions were related to non-restorable tooth fractures, which accounts for more than 50% of the teeth, or to prosthetic or periodontal considerations, which accounts for 25% of the teeth. That's all. Thank you.